Hello and welcome to this AAA quick take on the executive orders for the mandatory COVID vaccinations. My name is Scott Moore with Moore EMS Consulting, and I am the AAA's HR and operations consultant, and it has been a very busy 24-hour period. Yesterday, President Biden held roughly a 40-minute press conference where he discussed two new executive orders. The first one being the executive order requiring coronavirus disease vaccination for federal employees, and the second, the executive order on ensuring adequate COVID safety protocols for federal contractors. During the press conference, the president highlighted that nearly 80 million people in the United States, nearly 25% of the population, still remain unvaccinated. And of course, discussing that due to the Delta variant, he is taking these executive actions to try and stop the spread and to protect federal workers from not only getting sick, but then also from spreading the COVID illness to not only their coworkers, but then the public that they serve, really citing that in order to promote health and safety and to protect the public, the president is instructing the Safer Federal Workforce Task Force to issue guidance in the coming days to all covered agencies. This Safer Federal Workforce Task Force includes the General Services Administration, the Office of Personnel Management, Centers for Disease Control, the Department of the VA, as well as FEMA, the Federal Protective Services, the Office of Management and Budget, and the United States Secret Service. So this agency or this task force will be issuing guidance to all of the involved federal agencies about sort of setting some of the definitions and standards. Now, what we do know so far, and so a lot of questions people are asking, what I will tell you is in reading both of those executive orders, watching the press conference, and I just a few minutes ago finished watching a briefing from the United States Department of Labor, there are still a ton of questions that are not answered, and likely we will not know the answer until these new rules have been published. But what we do know is that the president essentially said, look, if you are a federal employee, you will get vaccinated. And if you are a federal contractor, you want to do business with the United States government, you will, in fact, have your staff be vaccinated. So that includes all contractors and subcontractors of any dollar amount. All right, in addition to that, what we know is OSHA, who, as I said, just held a briefing for employers, will be issuing another emergency rule. So we know that a few weeks, maybe a little over a month, a couple months now, OSHA released the emergency temporary standards specifically for health care workers. What we do know that, of course, is that now under this new, OSHA will be issuing new rules that will apply to employers with 100 or more employees, and that will require those employers. And when we say 100 more employees, that's not per work site, that's total. So if you are an employer of 100 or more employees, regardless of where those folks work, with one exception, if they're remote, if all of your employees are remote, then those remote folks, this won't apply to. But what we do know is if you have 100 more employees, you are going to have to require vaccination and or weekly testing. In addition to that, as we know under the emergency temporary standard, you are already required, those employers covered by the emergency temporary, were already required to either provide paid time off or permit employees to utilize existing paid time off programs so that they can access vaccination and recover from any potential negative side effects from vaccination. And with this will carry up to a $14,000 fine per violation. So as I said, just literally, I think 5 minutes ago, the United States Department of Labor just finished up a briefing for business, an update on the proposed COVID-19 workplace protections. On the briefing was Catherine Eister, who is the U.S. Department of Labor advisor for the private sector, as well as Jim Frederick, who is the Deputy Assistant Secretary for OSHA. So what we know at this point was they were really just trying to, because I think their office has been getting flooded with questions. The briefing lasted about 30 minutes or so, but they were essentially asked any folks who were in attendance to submit their questions at a time, and to the extent that OSHA could answer those questions, they answered them live during the event. So one of the things question came up was, hey, what's the timeline on this new emergency rule? And the answer is there is no specific timeline, but that certainly they are working as urgently and will get this rule out as quickly as possible. One of the attendee questions was, will there be a listening opportunity or a public comment opportunity? And the answer was no. Just like with the emergency temporary standard, prior to that emergency rule being put out, there is not going to be any listening sessions or opportunities to submit comment. Why? OSHA's response to that was that they have been listening to employers, hearing from employers now for the last 20 months, and they feel like they have a pretty good understanding of what is going on in the workplace. One of the things that they did do, though, of course, was to thank employers and workers for their work over the last 20 months of this pandemic. But what they said was, after the rule has been issued, as you may or may not know, from an administrative perspective, the emergency temporary standard or any emergency rules that get issued, really that they do become law or regulation as soon as they're published. And then there's a period of time at which the public will be able to submit some comment prior to them becoming permanent rules or regulations. But make no doubt about it, they are, in fact, law as soon as they are published. Now, couple of questions. Who's going to pay for this for those employers with 100 or more, either vaccination or testing? They weren't able to answer that. They said that will be absolutely addressed when the rule is published. There was a question about, well, geez, if I'm a federal contractor and I'm an employer of 100 or more, how will these competing standards between the federal contractor rules and OSHA rules work? They said that they will ensure, and they're working with those other agencies, and they will ensure that the standards are consistent. One of the last questions in the probably 10 or 12 that were asked was, how will employers, or will the standard include some process or requirement for verifying an employee's vaccination status? And they weren't able to answer that, but said it would be addressed in the emergency rule. I do know and have heard that there are fines, because I understand that you can download a vaccination card. It is a crime, in fact, to download a vaccination card. So what I would say is there will be a verification process. The Department of Labor is well aware that, in fact, those cards are out there on the internet. So there will be addressed in the rule some verification process for employers, so you can ensure that your workforce is, in fact, you are compliant with these standards. One of the things that they did say, though, was that you should start that vaccination process as soon as possible, because just recognize, as soon as that rule comes out, you will have to comply with that rule as soon as possible. There was a question just about, geez, if we have one shot, but by the time the rule comes out, or by the time October, when the rule when we believe the rule will become effective, will that be enough? And they weren't able to answer that question. One of the other things that came out of the press conference yesterday was that currently the CMS has regulations for long-term care facilities, and the fact that long-term care, those who work for employees of long-term care facilities must be vaccinated. They are going to expand those vaccination requirements to include other Medicare certified facilities, including hospitals, dialysis, ambulatory surgical centers or settings, as well as home health. Now, one of the big questions that I've been getting over the last 24 hours is, does this include ambulance? Because in the press release, the link that the CMS cited in their announcement actually takes you back to a page where all of these are listed, but so is ambulance. And so we actually don't know the answer to this. We're waiting for, we have reached out, the AAA has reached out to CMS to try and get some clarification, and we are hopeful. As soon as we know anything about that, certainly we will make sure that we record another one of these and that we get some guidance out to you folks. So lots of questions. Of course, as I always say to folks, the most important thing is, regardless of these mandatory vaccinations, do not forget that as employers, if you are covered by the ADA or you're covered by Title VII, you are obligated to still engage those employees who have a disabling medical condition or a condition that would qualify under the ADA, or who have a sincerely held religious belief as covered or protected under Title VII. You still have an obligation to engage those folks into the interactive process. Now, of course, we've said, and this was released in the AAA's HR manual this past year, there was a vaccination policy that did include COVID, as well as a reasonable accommodation request form for both medical and religion, as well as a reasonable accommodation process form to make sure that you go through all of the steps that you should be going through, and to document that process as you go through the interactive process. So it's important that you have a consistent process, because in the event that you determine that you're unable to provide that vaccination or that accommodation request, and there is some subsequent legal actions, one, you do want to be consistent and fair, but two, that provides you with the best protection in the event that someone files a charge against your organization. So with that, if you have a question about this or any of the COVID related, because it has been a busy day, we had additional provider relief monies announced today. But if you have this or any other question, you can submit your question to hello@ambulance.org. That's our new system that's allowing us to sort of more easily streamline and answer some of these questions. Certainly, alternatively, you can always reach out to me directly at smore@Moore EMS Consulting. With that, I, of course, want to thank all of you for all of the work that you do, and wish you continued safety and health.